Hello and welcome to LBT Wellbeing panel for Stonewall Housing. Stonewall Housing is the only housing advice and support service in the UK for all ages. We have been in operation since about 1983, I think. We have 41 bed spaces, and last year we worked with over 1,400 people. My name is Tina. I'm Director of Education and Engagement. My pronouns are she and her, and I've worked for Stonewall Housing for about 9 years. I'm going to ask everyone else on the panel to introduce themselves as well.
Hello, my name is Constantina and I just joined Stonewall Housing as a team manager. My pronouns are she and her.
Hello, my name is Jenny. I am the mental health advocate at Stonewall Housing. My pronouns are she and her, and I work predominantly with young people under the age of 25 who are experiencing mental health problems.
Hi, my name is Cheval Heaven. I'm a specialist LGBT housing worker. I've been working for Stonewall Housing for 5 years, maybe just a little bit longer actually. And my pronouns are she and her.
Hello, my name is Chloe Florence and my pronouns are she, her. I'm a writer, actor, poet, activist and change maker. I'm a member of the House of Stonewall and an ambassador for Stonewall Housing. I was actually a service user on 2 separate occasions during a period where I was homeless for 7 years. So yeah, some people in this room were actually my support workers.
Hi, I'm Kat. My pronouns are she and her, and I'm the fundraising and initiatives manager for Stonewall Housing. I've worked for Stonewall Housing for 11 years through various roles.
Excellent. Excuse me. So we're going to have a conversation around some research that we carried out during LBT Women's Health Week, actually. And it was about how the impact of insecure housing, the impact that can have both on your mental and physical health. And the research was carried out by one of our students, and it produced some really interesting results. You know, we interviewed, I think, 26 people, asked them about 17 questions. 90% of the people said the lack of access to housing or homelessness had a real negative impact on their mental and physical health. We had comments about how people had to lay it on thick to be taken seriously, how getting pregnant felt like the only way, being LGBTQ didn't make them a priority. And people said, you know, I felt like I had to explain my worst days as an everyday occurrence to be taken seriously. It was, I think the research was really interesting and threw up some really interesting things. 91% of people that we interviewed said government and housing services don't do enough to support LBT women. And we also asked them, you know, what is it that you need? And people said, you know, give us more space, more support services, put more funding into housing and more funding into specialised LBT housing. So I'm going to ask the panel a bit about what they think about some of the things that came out of the research and some of their own experiences, and ask them to share some of the things that have happened to them in terms of work. And so, Chloe, I understand that there are congratulations in order. Chloe was nominated as an unsung hero for the Diva Awards and won, which is really great. And I'd like, how do you feel about that, Chloe? Was it a surprise? Was it?
I mean, it was a surprise because Kat nominated me. It was a surprise to be nominated. That felt like a win for me, that somebody had actually recognized the work that I've been doing and stuff. So yeah, to win just feels really humbling. And as somebody that was like invisible homeless for so long and doesn't do any of this stuff for an award, you do it because change needs to happen, right? So to actually like be seen and recognized, I feel validated, and I feel like honored to just have been nominated, let alone to have won. So yeah, I'm guessed.
That's cool. And you were described as a total unsung hero, can I tell you? And the fact that you use your platform to amplify the voices, and you do that for us as an organisation and our current service users, really means that people's voices get heard. So I know that in terms of the research, what do you think was kind of the most surprising thing, or what was the most important thing, do you think, that came out of that piece of research?
So, I mean, as somebody that's been through it, nothing surprised me. I think if people read the research and aren't surprised and haven't been through it, then something is quite wrong, because it clearly shows that there's like a lot of problems within the sector and within how people are treated regarding their well-being. It kind of just made me feel validated in a way that my experiences weren't isolated, because when you're going through them, you very much feel like you must be the only one, because you go to different services and you're not taken seriously. And it just amplified the fact that people who are LBT women go through a lot of violence, go through a lot of mental health problems, and they are not taken seriously by services, and that they do have specific needs. And I think if this was happening to white middle-class men, then this probably wouldn't happen. You wouldn't let all that violence and stuff happen and be like, that's not a priority. So it just amplified that there is specific needs for LBT women, that they're not taken seriously by services, basically, which was my experience. So
I think that's a really valid point about how invisible LBT women are in housing, and how you have to shout really loudly in order to be heard. And I think the impact of that is absolutely huge. So Jenny is our mental health advocate, and as our mental health advocate, I'm really keen to hear whether you think what the impact and the implications there are on people's mental health when you don't have access to safe, permanent accommodation.
Well, I think the problem is everything in terms of mental health provision is really tied to you having access to accommodation. You know, you don't even get an appointment. You don't even get an appointment letter unless they have some kind of correspondence address. And you're more likely to slip through the cracks. And I think as LBT women, we are seen as invisible anyway, and the system doesn't really help that. And when you're invisible, you can often experience isolation. In some cases, some people feel that no one is looking out for them, so it's harder for them to look after themselves. And sometimes I've worked with clients who have a combination of, and in some cases quite severe, physical and mental health problems, which over time have not been addressed. So there hasn't been that early intervention which they needed to sort of help them. So it's only later on that when I see them that perhaps it's the first time they've been able to register with a GP, get a referral to mental health services, get support from maybe in some cases drug and alcohol services.
Yeah, so do people have any views about how we can change some of that invisibility, do you think? How do we make sure that our voices are heard more? Is there a way that we can change it? Does anybody have a view about that? We're all going to talk at once now. Kat, you wanted to say something?
No, it was Constantine.
No, okay. Chloe, did you want to say something?
Yeah, Constantina was going to say something. Let them speak.
Yeah, I was just thinking that like a very easy and direct way to solve this issue is to create more LGBT specific services, so that people don't have to go through the mainstream ones and have to educate in every single step the people who are there to support them. I think this is one of the main reasons why some people just kind of choose, but without having much of a choice, to not access some services, because they don't feel like they're heard, and they feel like they have to do extra emotional work and labor to actually educate the supporters. I think this is an obstacle, and we need more LGBT specific services, well-funded LGBT services, in order to kind of start solving this.
Yeah, I would agree. Kat?
I just completely agree, and something as the fundraising manager is constantly trying to explain to people just how essential our services are. We're not a luxury service because we're an LGBT service. We're an essential service for our community, and because of the lack of LGBT services in the UK in general, it means that often by the time people do come to us, because there isn't that early intervention work that Jenny was talking about, people are extremely vulnerable and their needs are extremely complex, and when they didn't need to be if there had been that correct support in place. So it means that we're working with people at a really high risk and vulnerability level, and we're funded at a lower risk, as a lower risk service, low support service. So it's a constant battle of trying to evidence the need and support our community with the tools and resources that we have.
Yeah, and I often think that one of the issues of going to mainstream services is that whole thing around you have to come out all the time, don't you? And you don't know what the response is going to be, and you don't know whether somebody's going to treat you very differently, or whether you're going to get a hostile response, or somebody's going to stutter over their words or look embarrassed, and that I think adds to the whole kind of the thing about approaching mainstream services. And something that came up in the research findings was about physical health being prioritized over mental health in terms of housing. You know, if your physical health is poor, you're often given a priority because of that, rather than your mental health. But I don't know, is that the case? Do people think that's the case?
Yeah, I think in some cases what happens is it's only when someone's physical health deteriorates because of their mental health, then they'll say, oh, hang on, perhaps we'll do some kind of support and intervention then. I think they see somehow physical health as being something that it kind of costs them more money. So it's more cost effective to actually get in and sort out someone's physical health. But their mental health, they don't really think about that. I've had clients who, I can think of one client in particular who had an ongoing, quite serious physical health problem, but that was also combined with their mental health. And the mental health was really driving the severity of the physical health problem. And it was only when the physical health problem got to a certain stage where it was like there was going to be major intervention, that's when they decided to do a holistic approach and do the mental health and the physical health at the same time. But until then, it was like almost two separate things, and they just didn't seem to see how that all worked together.
Yeah, it's interesting about that holistic approach, isn't it? Is that it's all very intertwined, physical health and mental health. And if you start separating it, you're often focusing on one thing and not the other. And some of the thresholds that people have to meet are really kind of quite high. I mean, I don't know, Jenny, in your experience, what you think about kind of the high thresholds people have to meet in order to get assistance. And also, do you think that it often just comes down to cost?
Cost is also, well, I mean, it's a really weird way of looking at cost. I had I contacted one mental health service, and they said to me, this is about a client I was very worried about, and they said, well, when they get really ill, contact us then. And I said, well, that's actually going to be not really cost effective. That's actually going to cost you more time and effort, because then we'll have to involve the crisis team, the home treatment team. You know, they might be admitted to hospital. So can we kind of look at some support for this person before it gets to that stage? Because it will actually save you money. And when they heard that argument, it was like, that was about the only time they thought, well, actually, maybe we do need to see this person first. But it was only because it was going to save them money. But otherwise, you know, their first thought wasn't about, oh, we need to kind of help this person. It was more about, oh, you know, actually, it might save us a bit of money if we do it now.
And how dreadful is that it comes down to the cost, and that it's about being cost effective? It doesn't put the person, you know, lots of organisations talk about person-centred care and holistic wraparounds, and actually, do they actually put the person at the centre of what they're doing if it becomes about cost? It's quite, I mean, I think that's quite appalling, really. What do other people think? Do you kind of agree with what Jen is saying around how physical health is prioritised?
Yeah, I would agree. That's kind of my experience as well, and it shouldn't have to get that bad. I think what Kat and what Jenny was saying kind of linked together, and that it shouldn't have to get that bad. The system clearly doesn't work, and as women, we aren't believed when we're in pain anyway, let alone to add to that being queer and then maybe being another type of minority, and it just adds to each other. So you have that to face. So yeah, I do completely agree. It shouldn't be the case, and the cost effective thing is an absolute madness, but that's how it is. And yeah, it's appalling, to be honest.
I also think that physical health is easier to measure than mental health. You can score it against something on a piece of paper in a way that you can't with mental health for some reason. You know, they can watch you walk up and down a room. They'll watch you sit down, stand up. tell me how much pain you're in, that kind of thing. But explaining mental health is a difficult enough job, even if you can advocate for yourself, you know. And then what about the days that you can't? And so that's why people like Jenny and those services are so essential, because when you can't talk about mental health, and especially when that relates to your gender identity or sexuality, it's so difficult to navigate those conversations with healthcare professionals, usually 9 times out of 10, meaning that you don't access the right services because of it. So,
and often I think you know, there's that thing around services don't often reflect the people that use them, particularly when you're talking about LBT women. And actually, in order to feel really safe about using a service, it has to reflect who uses the service. So I know that a lot of people don't approach those mainstream services because they don't feel like those mainstream services are for them. They don't feel like they're relevant. It goes back to all that thing about having to do all that what I think Constantina was saying about educating, about how we have to become the educators, because people don't understand. And you imagine having to be an educator when you're trying to advocate in terms of mental health or physical health, and you've got insecure housing, which is impacting on your physical and mental health. You know, it's a lot to ask of somebody, I think. I mean, I think and I know that in terms of presenting people to kind of local authorities and panel reviews, and Cheval, you've got the most experience about this, and supporting young people to access housing has been your role for about 5 years. But do you think there's quite a lot of pressure and managing expectation when you present people at panel or presenting people to local authorities? Do you think that has a lot of, excuse me, do you think that has a lot of impact on somebody's well-being?
Definitely. I think most definitely. I think from my personal experience working with, you know, LGBT young people anyway, it seems like we have to over exaggerate the situation, and we shouldn't have to do that. You know, it gets to the point where I have to tell my young adults that, you know, explain your worst day, and for them to sit there and tell me what's going on. And even though I know what's going on because I've been working with them for how many months or years, you know, getting them to relive their trauma every single time to tell other professionals how they're feeling on that worst day is wrong. And just so they can understand that actually they may look like they're okay, but they're not doing okay. You know, they're going through so much issues because they're trying to be strong for a system that doesn't accept them for being them or for what it is that they're going through. You know, echoing what Chloe and Kat and what everyone on this panel was saying about physical health, they see more because you can see it. Because you can, like what Kat said, you can put it to a piece of paper and say, okay, well, this person is suffering because when they get into the room, they were limping and their face was in excruciating pain. Mental health gets dismissed because you can't see it. And my young adults have to tell them on their worst days how they're feeling. And when they come home, you know, I'm dealing with the aftermath because they're trying to, what's the word? Not only have they had to explain their pain, they had to explain the pain that they haven't had to face for such a long time because they're trying to cope with it. So myself as a professional, all I'm doing is firefighting before I can actually coach them to kind of get themselves out of that situation. And then it makes it worse when we present them to panel. And even though panel might understand, but then there are people that they have to report to don't. So we go back. It's like taking 1 step forward and 5 steps back. And it's just not fair.
Well, absolutely not fair. Absolutely not fair. And that whole thing around re-traumatizing people and how we expect, you know, how those kind of professional things like local authorities and panel reviews, they expect people to recount all of those traumas. You know, you think about the amount of times that some of our young people have to talk about what's happened to them in order to get access to housing is you know, I mean, I can't even think about how many times that happens and how traumatizing that is. Chloe, can I ask you, because you probably experienced that. So is that how you found it?
Yeah, and it's dehumanizing and it is re-traumatizing and it shouldn't be the case. And you can't really it's hard to get better when you're having to present yourself on your worst day and relive everything. And I think that's one of the hardest things. I've experienced it on one side being like, oh, don't let them see that you're that mentally unwell, you won't get housing. And I've experienced it on the other side where it's like, show them at your worst or you won't get money or you won't get housing. And actually, like, I feel like as a homeless person, I've become like a professional bullshitter. And it's not that I'm bullshitting, but I literally have to, because if the system is failing you and it isn't working for you, then you have to play the game and play the system. And that should be the case. But if it's going to play, if you don't, it will literally play with your life. And I'm sure Cheval has dealt with a lot of different variations of that. And I have my experience and it's a lot to deal with. So I can only imagine how many other people there are that are just reliving and having to talk to people that just don't get it. And it's really hard to vouch for yourself as it is. And, you know, and you go away thinking, oh, maybe I'm worse. Or if they don't believe you, you think, oh, maybe I'm fine. Maybe it's all in my head. And it just is a cycle of your mental health getting worse. And how are you supposed to get better when that is the environment that you have to go through constantly?
And it means that you go back to that thing around, you have to shout really loudly in order to get anywhere, in order to get anything. And the impact that has on mental and physical health, just in order to access housing. You know, there's 280,000 homeless people, and quite a percentage of those are young LGBTQ people. We know that from kind of anecdotal, but we also know that from some of the statistics. And I think that thing around having to exaggerate all the time your health conditions, based on your worst day, means in some respects you're not, I want to say, like, you're not being your authentic self, because actually you might be on a really good day and you have to go and present and you have to tell them what it's like on the worst day, and then you're going to come out of that meeting feeling like you're on your worst day because you've had to tell people that you're on your worst day. And I think I get really annoyed about it. I think quite incensed about the fact that we put people through that. We put young people through that. Young LGBT women go through that in order just to get access to housing. I mean, that's the work that we do, and that's why it's so important. But it frustrates the life out of me. And so some of the other things that we were talking about is some of the impact that being homeless can have on kind of some of the solutions that people look for. And we know, we've been in existence for 38 years and we've collected data and we track trends and themes. And what we know about places to sleep is some of that can be transactional. It can be, you're on the street and you're homeless and you're looking for somewhere to sleep. And some of that can be transactional. It can be some people, we hear narrative of people getting into really quite risk-taking behaviour in order just to have somewhere safe to stay. And I wonder, Constantine, I know that's your kind of experience, and I wonder if you could tell us what it is that you think about that.
Yeah, this is something that we definitely see often in our work. And what I think is very interesting is that even if you try to find research relating to LGBTQ plus people and exploitation in such a manner, because these transactional situations often lead to exploitative situations, you will not find much of research, because there is research for mainstream research, but nothing specifically for LGBT people, which is surprising given how big of a percentage of homeless people is actually LGBT people. Before I joined Stonewall Housing, I worked for years within the modern slavery and exploitation sector, and I worked with survivors, and nearly all of LGBT survivors' cases had the transactional element leading to the exploitation. So a very common scenario that I've seen play out in these cases is that somebody finds themselves homeless usually after the family breaks down and rejects them for being LGBTQ, and then somebody who first appears to be like a benefactor just offers a place to stay in exchange for sex or other services. Very soon the person realizes that the host is not really a benefactor, and then there's they go down a path with exploitation. And this is something that happens with homeless people, but LGBT homeless people more than others. And in contrast to non-LGBT people, when LGBT people approach professionals to seek help, on top of everything that they have to face that was just mentioned before, they have to deal with professionals that see this as a lifestyle choice. Like, this is what LGBT people do. This is how they behave. Like, this is what professionals think of us and how we live our lives, which is not true.
The amount of times I've seen that written across referral, lifestyle choice, and it boils my blood. And I just completely agree with what you've just said, Constantina, about how this is just how queer people are now viewed. Like, oh, we're just into sex, drugs, and rock and roll, and that's it, you know. And that's one of the reasons why a couple of years ago I was like, there is no safe, sober space for queer people in Soho. And that is where all young LGBT people tend to flock. And so we made a safe queer space in Soho, just so that there was one. And unfortunately, the pandemic's put an end to that. But yeah, it's really difficult when you're trying to role model for the younger generation. And homelessness often leads to transactional sex or other services, which leads to substance misuse or self-medicating, which leads to mental health, which leads to poor physical health, and then you're snowballing before you know it, and then you've got to access services and you know, just seems like it's your fault because of your lifestyle choice. I just completely agree with what you've just said.
It's interesting about the lifestyle choice, isn't it? I had because I do training and I train housing officers, and I won't say where this housing officer worked, but I had a housing officer tell me that every time they've had an LGBT person in, they think they have a sense of entitlement. It feels like they're entitled to housing, and absolutely not true at all. He'd had a really bad experience with one person and had judged everybody else that he saw on that one experience. And it was, you know, he was just, they're just really entitled. They just think they have their priority for housing. So no understanding about the trauma that might come behind that in terms of homelessness, in terms of some of the experiences they will have had. And again, it's a lifestyle choice, isn't it? Which is something that I think that gets thrown all the time. And the kind of lack of services, I think, is really telling, and the fact that the services that there are quite underfunded. You know, we are in terms of our services are quite underfunded, and I think it needs to be a priority. So my question, I guess, is how do we change it? How do we make it better? What is there a solution? I mean, as a trainer, I would say the solution is really good training and organizations that buy into really good training. But what do you think the solution might be? Is there one? What would you do?
I think some of these organisations, especially sort of like the big ones like the NHS, they should come to us as people who are experts to help train their staff, but also help them to create the right environment for people so that they can be comfortable using those services. And, you know, there's just such a disparity because, you know, I will get someone from the NHS and, you know, they have squillions of pounds, not as much as they should have in some cases, but then they're calling me and I have like £2.50 and they're saying, you know, can you work with this client? You know, because one person, just a social worker, says to me, well, they're gay, you know, and that was it, you know, therefore you're supposed to deal with them because we as a big organization, we don't have the time or the inclination to do that. And I think it's that othering of people, because when you see people as other than yourself, then it's much easier for you to just ignore their kind of wishes and see them as people. And I think that's a big problem in mental health, because I think sometimes, you know, when I am working with clients who they're very educated, they're very articulate, and we go to meetings and they say, well, that person can't really have any mental health problems because they look just like me. So they can't have any mental health problems. And I think it's that kind of unothering that needs to take place. And I think having services where they actually do joint work with clients, I think would be really helpful.
Yeah, I think so as well. And I think for LBT women particularly, and particularly for trans women, I think they often have to shout louder than anybody else, and particularly trans women, people of colour. We know that kind of within our community, there's this hierarchy, and those people are, I know Jenny and I have had this discussion before, that those people come right at the bottom of the kind of hierarchy that there is, and have to shout louder than anybody else. And like you say, Jenny, it's frustrating, isn't it, that the NHS have all this, millions and billions of pounds, and there's Stonewall Housing that don't have a lot. And relying on our services because somebody's gay, and therefore we know everything about everything that there is about being gay, and then that's all that somebody needs. And it's almost like abrogating responsibility, isn't it? It's going, okay, so you can be responsible, so we don't have to. So what do other people think might be a solution?
I think we do a pretty good job already, especially within our housing team and the young people that we look after, talking to them and encouraging basic self-care and understanding what that is in terms of looking after your well-being. And that's not necessarily taking medication or going to therapy always. Sometimes it's run yourself a nice bath, it's take your time blow drying your hair, or going to get your hair done, or be and sit in your room and acknowledge the things that you have, and mindfulness, and all of those holistic things are just as important as material things or medication and therapy. It's about being present. It's about being aware of how you feel, making intentional choices for yourself and your life, and just encouraging that. When you're homeless and you've been isolated from your family and or community and or faith group, often service users only have Shabal or one of our key workers to talk to and see them through these rites of passage. Getting your first job, trying drugs for the first time, going on the scene for the first time, your first breakup, your first driving lesson, all of these things we see our young people through and celebrate with them, for them. And a part of that comes with learning about what is self-care, what intentional choices do you want to make, how do you want to develop as an adult. And I just think the more we talk about mental health, the more normalized it will be to talk about that, and it will break down that physical health over mental health. So we just have to continue to talk about it, and especially LBT issues. All of our support is through an LGBTQ plus lens. So talking about healthy relationships and coming out safely, and all of these things that we do are just vital to continue, and to make sure that other people have these conversations as well.
A Stonewall Housing in every town, then? Every city should have a Stonewall Housing. Is that what we're saying?
Every borough should have Stonewall Housing.
Everywhere should have Stonewall Housing. So I guess just bringing it to a bit of a close, just for the last 5 or 10 minutes, I think, particularly we can't talk about LBT women and housing and homelessness without thinking about the impact of COVID. It's had a massive impact on us in terms of our working lives, in terms of homelessness, with the Everybody In campaign, which, we won't talk about that. It's got various government initiatives, some which have worked, some which haven't. But there has been this massive, we've had an increase in our calls. Most LGBT services that I know have had this increase in people contacting them over the period of COVID. And there's a lot of evidence to suggest, I've been reading some research recently about how, particularly for young LGBT people who've been at school where they can be really authentic, having to be at home where they can't be authentic because they live in homophobic, transphobic, biphobic situations, has had a real impact. And COVID has had this real impact, I think, on mental health. And I think, so my question would be, what would be your best advice? What would be your top tip for self-care and looking after your own well-being? If you had to share that with the people we work with, or just with our group here, what do you think? What do you think it would be? Kat, can I start with you? What would be your best tip?
My best tip for self-care would be to make intentional choices, to think about what it is you're doing and do everything, even if it's a bad decision, fully commit to it. You know, be in control of your decision. Sometimes you don't have control of your environment or where you are or what other people do to you, but you do have control of your choices. And so make sure everything that you do, try to be intentional with it.
Yeah, I would agree. Jenny, what would you say?
I think often people have felt, because they've been judged because they're LBT, sometimes it's really difficult for even the most talented and wonderful people to see that they are, you know, wonderful and talented people. So I think being able to look at the kind of positives about you as a person. I think having people around you who value you, having mentors, is really important, because sometimes people don't always see it in themselves. But if they have someone else, and, you know, I think there's still a mentality that, you know, you're the only gay in the village, the only lesbian in town. So I think if you meet more people around you who are positive, and I found that out, you know, that having those people around you as a support was really helpful when perhaps, you know, you're feeling quite low, that you have those people around you. So you know that, you know, today might be really crap, but, you know, you can see some hope because there's people around you who are still supporting you.
Yeah, definitely. I agree totally, Jenny. Constantina, what about you?
I would say that, yeah, when you have like a safe space and some time for yourself, and you're not in danger and risk anymore, maybe it's a good thing to just stop fighting for a while in order to, you know, regain your strength, be able to focus on your mental health. Because what happens many times, especially in COVID times, is that we struggle to access housing, to access services for our mental health, and it's a constant fight from childhood sometimes till adult life, and there's no moment of peace and quiet. And then when we find this moment of peace and quiet, we just keep on reading, for example, news that are bad, things that are happening, and we keep fighting and fighting, and this might lead us to a burnout. So it could be a good thing to just take a moment, distance yourself from the ugliness that is out there, and just be with yourself and relax. And then, you know, you can still continue fighting after you're okay with yourself. But if you're not okay, you can take a step back and just relax.
I love that idea of taking, it's like taking a breath, isn't it?
It's
Just
like
kind
taking
of,
a breath, and we
yeah.
all sometimes feel like we don't have the right to take a breath because we're a minority and we have to keep fighting. And as soon as we liberate ourselves, we feel like we have to liberate the others, and that's actually true. But at the same time, we have to keep fighting for ourselves. And sometimes fighting for ourselves means taking a breath.
Yeah. Yeah, I so agree, Constantina. Siobhan, what about you? What's your best tip?
My best tip will probably be stay off social media. That's the only thing that I can advise. The reason why I say that is because, you know, this whole pandemic, it's been hard for every single one of us. And, you know, my clients, the only thing that you can do in this time is to buy time, is to scroll through your phone or your laptop or whatever it is that you have access to, and look at other people living life, or lying, should I say, through a lens, creating a life that they want to live and that they're not living, you know, giving you a false wish of what it is that they're going through, and what it is that they are not going through. I just say, look, just turn off your phone, do something for you. I think coming off what Constantina said was just be there for you, whether that is trying to do a little bit of a workout in your household or anywhere that's safe for you, picking up a book, go into a fantasy world where you haven't got to constantly competing with other people because you think they got it made and you haven't yet. And that's not truth.
Really, that's such a good tip. Such a good tip. I'm going to say mine and then I'll finish with Chloe. So I would agree with Cheval, turn your phone off, take a breath, go for a walk. Mine is also step away from my computer quite often, because I think in COVID and working from home, we've got very kind of focused on work, and actually we forget to live sometimes. And I think that work-life balance is really important. But that thing around social media, absolutely, turn your phone off and go and take a breath, and feel, particularly like Constantine says, if you're in a safe space, kind of embrace that safe space and just take a moment, particularly if you like you say, you've been fighting for so long. And I think we do fight. I think as LGBT women, particularly working in this sector, we fight all the time for the people that we work for the organizations that we work for, sorry. And I think we fight all the time, and actually sometimes we forget to take a breath. So Chloe, what's your best tip, do you think?
I think I want to echo everything that everyone has said, and I've also come off social media for that exact reason. And even the fact that I'm housed now, it does feel like you've never had a chance to like breathe, and then you kind of have to actually process everything because you're constantly on survival mode. So for me, it was actually reconnecting with the self that you were like forced to run away from, and realizing that the mental health stuff and your trauma was not actually your fault, and you can't actually take responsibility for that. But what you can take responsibility for is what happens in the future. And like Kat was saying, the choices that you make, and being kind to yourself, and knowing that you can't go out there and help other people until you've helped yourself. You can, but you deserve that. And knowing that you deserve that, and that other people are going through stuff as well, and actually like taking things one step at a time is like a big thing. Like we physically can't do more than one thing at once, so just doing that one thing, fully participating in it, being mindful in that one thing, and just reconnecting with like the goodness in you. People are inherently good. That's one thing I learned in therapy, is that even children, they're inherently good. You get them to pick a good or a bad egg, and they'll pick the good one. They're just inherently good, and that's who you truly are. So yeah, reconnecting with the goodness in you and just being kind to yourself, because it's really hard right now. And also there's not one size fits all. So yeah, you can take all this advice on, but if it doesn't work for you, that's okay, because we're all different. But yeah, that's what I would say.
Great piece of advice, Chloe. I think that thing about we're all different, and what works for one person doesn't necessarily work for you, but actually finding the thing that works for you, finding that, and it might be turning off social media, it might be reading a book, it might be just staying in one space and taking a breath and kind of being in the moment. And yeah, great advice from everybody. I think really lovely to hear. So drawing us to a close, I would like to say thank you to the amazing women of Stonewall Housing for everything that you do. I'd like to say thank you to Diva for inviting us to be part of Lesbian Visibility Week. We're really happy to do this. It's been really good, actually. I've really enjoyed it. And thank you to everyone that donated last night to us. And please, if you haven't donated and you want to, then check out our social media platforms and our website, and you'll find out how you can donate to the great work that we do. So yeah, thank you everybody, and have a great day. Bye.